Hello, I'm Jan Mold, Deputy Director of Competitive Events for HOSA-Future Health Professionals. And I'm going to be talking today about a topic that unfortunately many in America know a lot about, and that is the opioid epidemic. There is no us and them when it comes to the opioid epidemic and when it comes to health. We are all in this together. That's a quote from Dr. Jerome Adams, the 20th U.S. Surgeon General. And I want to share with you a short clip of him talking about this topic.
I get asked all the time as Surgeon General, what's the biggest killer out there? Is it tobacco? Is it sugary drinks and obesity? I think one of the biggest killers out there, if not the biggest killer, is stigma. Stigma keeps people in the shadows. Stigma keeps people from asking for help. Stigma keeps people from, like my brother, from even recognizing that they have a problem. I don't have anxiety. I don't have depression. I just need to be tougher. We don't even admit that we have a problem. Stigma keeps families from coming forward and asking for help. And the more that we share our stories, the more we break down stigma, because stigma is when we separate ourselves into us and them. We need to show people there is no us and them when it comes to the opioid epidemic and when it comes to health. We're all in this together. We think of people with substance use disorder as coming from a bad background, a bad family. Well, my family managed to raise a Surgeon General of the United States. I think they did okay. There's families across the country that want to talk to my mom and dad and say, how can I do what you did? Because I want my kid to be a Surgeon General one day when they grow up. But those same parents, that same household, produced my brother, who is now in jail with untreated still substance use disorder. So if it can happen to our family, it can happen to any family.
Like Dr. Adams, one of the greatest pleasures I've had this year is being able to share brief mini lessons with students across the HOSA membership. And this is a stigma that I want to break down for very personal reasons. Like Dr. Adams, I have a son who has struggled with opioid addiction. He overcame that to move into alcohol addiction. So it's striking families because we are in an epidemic regarding opioids. So what are opioids? They are used to diminish the body's perception of pain, and some of the examples, the prescriptions, morphine, codeine, methadone, oxycodone, hydrocodone, fentanyl, and then the illegal heroin. According to the 2019 NSDUH annual report, and NSDUH stands for the National Survey on Drug Use and Health, 10.1 million people aged 12 or older misused opioids in 2019. 7,630 people died from drug overdoses in 2019. And one of the things we're seeing in the news because of the COVID epidemic is that will probably be increased significantly. So what can we do about it? One of the things we can do is safely dispose of drugs. And this is Take Back Day. This is sponsored by DEA. And basically, it's National Prescription Drug Take Back Day that really talks about this public health issue of not having misused prescriptions, not keeping them in your home. To rethinking pain treatment. And this is Health and Human Services. This is a final report that was published in 2019 on the best practices. And it talks a lot about how we should be prescribing, and it specifically talks about opioids. Improving opioid prescribing, and this comes from the National Institute on Drug Abuse, how opioid prescriptions can play a key role, those that prescribe can play a key role in stopping the overdoses. National Prevention Week. And this comes from SAMHSA. And again, how do we prevent it? So May 9th through May 15th, coming up pretty soon, is when there is an observance. Communities and organizations across the country come together to raise awareness. So hopefully that'll come about the time you're watching this, or your HOSA group can make it an initiative to increase awareness. This is from the CDC. All campaign resources about the campaign, so you can find out more about it. Also, being able to find treatment. That can be a problem in some areas. It also can be a problem for people to afford it. So you type in your zip code and it gives you some step-by-step treatment guides. It helps with behavioral treatment locators. So all the information is provided there. And then probably most of you have heard of naloxone. Naloxone is an antidote that's used. And I want to share this brief video. It's 5 minutes and 40 seconds, but I want to share it with you because I think it's extremely important.
Naloxone saves lives.
Hopefully we can get it playing here.
No time to sit idly by. More and more people are dying of overdose from the likes of heroin, fentanyl, and prescription pain medications like oxycodone and hydrocodone. These are all examples of opioids. Opioids are drugs derived from the opium poppy plant or made in the lab. They can treat pain, cough, and diarrhea. But opioids can also be addictive and even deadly. The number of opioid overdose deaths has escalated more than 400% since the turn of the century, with tens of thousands of lives now being lost every year. But many deaths can be prevented with a life-saving treatment, naloxone. When given right away, naloxone can work in minutes to reverse an overdose. Naloxone is safe, has few side effects, and some forms can be administered by friends and family. When is naloxone used? You can save a life. First, recognize signs of overdose: limp body, pale clammy face, blue fingernails or lips, vomiting or gurgling sounds, inability to speak or be awakened, slow breathing or heartbeat. If you see these symptoms, call 911 immediately and consider the use of naloxone if available. How is naloxone given? Home preparations include a nasal spray given to someone while they lie on their back, or a device that automatically injects medicine into the thigh. Sometimes more than one dose is needed. The person's breathing also needs to be monitored. If the person stops breathing, consider rescue breaths and CPR if you are trained until first responders arrive. How does naloxone work? Naloxone is an opioid antagonist, which means that it blocks opioid receptors from being activated. It is so strongly attracted to the receptors that it knocks other opioids off. When opioids are sitting on their receptors, they change the activity of the cell. Opioid receptors are found on nerve cells all around the body. In the brain, opioids produce feelings of comfort and sleepiness. In the brainstem, opioids relax breathing and reduce cough. In the spinal cord and peripheral nerves, opioids slow down pain signals. In the gastrointestinal tract, opioids are constipating. These opioid actions can be helpful. The body actually produces its own opioids called endorphins, which help calm the body in times of stress. Endorphins help produce the runner's high that helps marathon runners get through grueling races. But opioid drugs, like prescription pain medications or heroin, have much stronger opioid effects, and they're more dangerous. Over time, frequent opioid use makes the body dependent on the drugs. When the opioids are taken away, the body reacts with withdrawal symptoms such as headache, racing heart, soaking sweats, vomiting, diarrhea, and tremors. For many, the symptoms feel unbearable. With continued use, opioid receptors also become less responsive, and the body develops tolerance to the drugs. More drugs are needed to produce the same effects, which makes overdose more likely. Overdose is dangerous, especially for its effect in the brainstem, relaxing breathing. Breathing can be relaxed so much that it stops, leading to death. Naloxone knocks opioids off their receptors all around the body. In the brainstem, naloxone can restore the drive to breathe and save a life. But even if naloxone is successful, opioids are still floating around, so expert medical care should be sought as soon as possible. Naloxone works for 30 to 90 minutes before the opioids return to their receptors. Naloxone may promote withdrawal because it knocks opioids off their receptors so quickly. But otherwise, naloxone is safe and unlikely to produce side effects. Naloxone saves lives. From 1996 to 2014, at least 26,500 opioid overdoses in the United States were reversed by laypersons using naloxone. While naloxone is a potentially life-saving treatment, more needs to be done to solve the opioid overdose epidemic. The National Institutes of Health launched the HEAL initiative in 2018, expanding research across multiple NIH institutes and centers to speed scientific solutions to the national opioid crisis. Research is underway to improve treatments for opioid misuse and addiction, and to enhance pain management. The National Institute on Drug Abuse, or NIDA, is the leading NIH institute for research on opioid misuse and addiction, and its support helped the development of the user-friendly naloxone nasal spray. For more information, see NIDA's website at drugabuse.gov and search naloxone, or visit nih.gov and search NIH HEAL Initiative. General opioid information can also be found at medlineplus.gov. This video is produced by Medline Plus, a trusted source of health information from the National Library of Medicine.
So some information on naloxone for you. The Health and Human Services has a 5-point strategy: better services for addiction prevention, treatment, and recovery, better data, better pain management, better targeting of overdose reversing drugs, and better research. And you just saw some of those outlined and where they're occurring. The HOSA Connection, there are 3 events at least that this could very easily fit in. One is behavioral health. That is a written test. Community awareness program, where your HOSA chapter could have a team that increases the number of people that understand about opioid epidemic and naloxone. Health education, an opportunity to teach. One of the things that I wanted to share with you is a couple of PSAs that were provided by the CDC. And I think it's really important that we see it as not just a they problem, but it's an us problem. This is Anne Marie's story.
My son, Christopher Parado, was 20 years old when he was prescribed opioids. It took him 5 days to get addicted. I'm not supposed to be the one to go get his suit and tie and pick which sneakers that I'm going to bury him in. My son overdosed at the age of 22 years old.
One more that I wanted to share with you is Mike's story.
I was given a prescription opioid pain medication that lasted a lot longer than the pain itself. At the time, I didn't understand the dangers of these drugs, and within only a few months, I was completely addicted. I lost everything. I had to leave school and stop playing sports in college, and I started to watch my life slip away. These drugs are addictive. One prescription can be all it takes to lose everything.
Excuse me. So it's your turn. I'm going to ask you to work in groups to create a PSA, public service announcement, which is 30 seconds, 2 of which you just saw. But yours is going to be focused on educating your peers about the dangers of opioid addiction. Your teacher may have you look at the PSA rubric in the HOSA guidelines for this project.